To Shadow Health Secretary Andrew Lansley, who believes Labour has failed to tackle England's public health problems. I just wanted to ask you, Andrew Lansley, firstly about the story in connection with organ donations and this news that we understand 21 families of bereaved people are being contacted now over the fear that organs may have been taken without consent. People will be really alarmed by this.
Yes, good morning. Can I just say on this, my personal view is that we should always have the consent either of individuals themselves while they're alive or of their families if they have died before taking organs. And clearly if that has not happened and it needs to be fully investigated, we need to make absolutely sure what has gone wrong and find out what has happened and to make sure it doesn't happen again. But I do hope that people hearing this will not feel that they should not continue to be on the organ donor register, to think about, constantly to be thinking about how they could help somebody else after they die. Here in, as you see, I'm in Cambridge, in my constituency, we have Addenbrooke's, which is doing fantastic work on liver and kidney and other transplants. We have Papworth, which is the leading British centre for heart and lung transplants. And I have met patients who have lived as a consequence of the work they do and because somebody has donated organs to them. So I do hope people will continue to see organ donation as something they can positively and altruistically do to help others.
OK, let's talk about the King's Fund review. Now, one of the things, amongst other things, that they accept and they say that things have improved in many areas, waiting times, the way patients are treated. But there is this, by 2014, they're saying there's a £21 billion gap in funding in the NHS. Do you recognise that gap? Do you agree there is a gap there?
I think first we should talk about because the King's Fund report is essentially about what has happened since 1997, and I think in that sense I think it's rather a missed opportunity to tell the whole truth and the unvarnished truth. I mean, you were talking to Chris Ham and he said, well, look, for example, infection rates have come down. I mean, Chris knows perfectly well that MRSA and C. diff infection rates in the NHS are twice what they were in 1997. In his report, they have compared the position on just two infections, those two, with 2006 when they peaked. Now, that's not good enough. We really must have the full truth, the unvarnished truth. And frankly, of course, the NHS, in many respects, has been improving since 1997, and rightly so. But the question actually is rather a different one. Has the NHS made the improvements we all would expect, given that the resources for the NHS have tripled since 1997? And we know the answer is no. The King's Fund report actually is clear that productivity has gone down, that many of the public health measures like obesity and alcohol-related disease, of sexually transmitted infections, these have got very much worse. And our performance in this country relative to Europe has not improved as it should. We do have cancer survival rates lower than most of Europe, not just some countries in Europe, than most of Europe. It's not just about variability. The government's own report said no cancer network in England has cancer survival rates in the main cancers as good as the best performing countries in Europe.
If I may, you used the phrase a moment ago, the truth, the whole truth, and nothing but the truth. Now, people all over the place are still asking those questions of all the parties, Conservatives included, as to exactly what the cuts will mean. It seems like most people think that when you say you're going to, I think the Conservative position is that you're going to increase funding in the NHS in real terms. Yes. But a lot of people think there is a different story in reality. And once you're in power, the realities of the economies you have to make will kick in. Now, when you make that pledge, is it an absolute? And can we be guaranteed that come the moment and you get the books in front of you, you're not going to turn around and say, well, I know we promised that, but what we're going to actually have to do...
Why should you... Well, forgive me, but why should you not believe what I'm telling you now? It is David Cameron, George Osborne, Shadow Cabinet and I have been absolutely clear. We have made our choice. It is that the NHS is our #1 priority. We will not let the sick pay for Labour's debt crisis. We will increase the NHS budget, the whole NHS budget, in real terms in each year of the next Parliament. That has been in our draft manifesto. It will be in our manifesto when it is published. And we are very clear about this. We have consistently been clear about it. And frankly, I think I'm rather offended that you should say, oh, well, you say one thing now and you do another thing in government. We wouldn't. We will live up to our promises. That's what people have a right to expect. It's not what has happened too often in the past, but it's what they have a right to expect from us. And I think actually it's pretty shameful, for example, that the Labour Party, knowing that we are going to invest in the NHS, are out there, as you can see from the front page of the Sunday Times today, scaring patients, misrepresenting what we have said. I'm actually rather shocked by what they've done, trying to target breast cancer patients and alarm them by making up stories about what the Conservative Party would do. I think Andy Burnham, the Health Secretary, should write to every woman to whom Labour sent their cards and apologise and withdraw it.
Andrew Lansley, we will leave it there. Thank you very much.
Thank you.
It is 8:20. You're watching Breakfast. The headlines. An investigation is ordered after the discovery that organs may have been removed from people without the correct consent after data